So in the first instance, symptoms are very varied, and sometimes could be even vague. So it would be important for clear guidance so that patients know a little bit more about this limitation that GPs have in diagnosing menopause. And in terms of resources, there are already a number of resources. It also depends on the population different GPs serve. For a long time, I was looking after mainly elderly population, so the HRT consultations I had were very infrequent. But now the population I'm serving is more a kind of middle-age professionals or younger families. So when first of all, I have had more frequent requests for HRT, but also the patients come already with information and expectations of what they would like to have. So they usually get their information either from podcasts, from celebrities that have given interviews on the wonders of HRT. And even some of them have looked at more professional guidance, like the British Menopausal Society or NICE, or other more robust evidence. But I think that we lack is a more balanced view, so that the patients understand there is not black and white in terms of HRT, and that we have really we need to have more balanced conversations with them about their particular circumstance. I would like to have a more concise guidance, information that we can give to patients, although I'm already using the NHS leaflet that's available, which seems quite concise. But perhaps to let patients know that they really need to have the conversation rather than the expectation that HRT is going to help with all their symptoms. I teach medical students, and I always say to them that it's important to have this balanced view about the menopause. Some people see it as natural life process, and sometimes we are medicalizing something that is a natural life process. However, this podcast that I was talking about, this interview that celebrity have posted in media, I think they usually don't portray a very balanced view. So I think that society needs to understand that this is a process that sometimes HRT may help up to a certain point. I am still a little bit uneasy with the advice that says that you can prescribe HRT up to the age of 70 or 80. I'm not sure if there is a lot of evidence that that would be okay. Also, in society, we need to understand the limitations of medication in general, not only HRT, but also anxiolytics, antidepressants. People expecting that these medications are going to be a panacea, that they expect the medication is going to sort all their problems mentally and physically completely, is an unrealistic expectation. And they need to understand that this is a very individual, tailored management. So that's why it's vital to have very balanced conversation with the GP. So I would expect that any guidance, any podcast or whatever, I say, look, this is the benefits. I had it. It's not for everyone. Go and have a consultation with your GP, but please do not expect, first of all, that everybody should have it. Everybody benefits from it, and just have this conversation with an open mind. There are several training resources. I think that actually role plays would be the most beneficial tool for trainees to learn how to manage this particular condition. Because the most difficult conversations I have had with patients is when they already come with a preconceived idea what they want and an expectation of what the medication will do for them. So you already know that there is a lot of information out there, guidance, leaflets, podcasts, but it's how to put that in practice when you have the patient in front of you. So role play is a good way of training. Discussing with other colleagues, again, you might bounce ideas from other colleagues, and even with more expert colleagues in secondary care that might have experience of other ways of managing the menopause when there are more complex issues. For example, if there is a family history of breast cancer, or if patients are expecting things like testosterone, which at the moment is not licensed for us to prescribe in primary care, but a lot of my patients come with the expectation of having this prescribed as well. I think probably those two things to me would be the best tool for training. Role plays, conversations with other colleagues and specialists, and perhaps sitting down and discussing the guidance that is already available and how we have been able to put it into practice, and what the limitations of this guidance are. That's it. Thank you very much.